Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The initial procedure in preparing to do this Class II gold inlay cavity preparation is the preliminary occlusal analysis. Place articulating paper between the teeth on the side of the arch which is to receive the restoration. Close the visidont teeth firmly together to obtain occlusal registration of the centric stops on those teeth. Now the tooth to be treated here is the mandibular left second bicuspid, or tooth number 20. The supporting cusp centric stop marking is rather heavily marked, and sometimes, as is seen here, the inserting an extracted natural tooth in this visidont has left us without marked marginal ridge contacts, but ordinarily we would expect to find centric stop markings on the distal marginal ridge and perhaps the mesial marginal ridge of this tooth. And the purpose is to know where those markings are, that we may have those preserved in the process of performing the cavity preparation and the completed Class II restoration for this tooth. The beginning of the Class II preparation for gold inlay will be to penetrate in the occlusal surface in the central fossa using this number 1 round burr for this bicuspid. The number 2 round burr would be used for the molar because of larger space and access. This is held approximately perpendicular to the axis of the tooth, and is placed in the occlusal to penetrate through the enamel, move slightly toward the distal, following the occlusal groove. And the depth desired here is going to be just into dentin, approximately 1/2 millimeter. Then change is made to carry out the initial extension of the occlusal aspect using a number 170 L tapered fissure burr. Now again, the axis of the burr is going to be basically in the long axis of the tooth and placed into the preparation has been established with the round burr and extended through the occlusal groove to establish the pulpal floor and the walls and the occlusal walls of this cavity preparation. Now it will be necessary to lean the burr slightly, as can be seen here, toward the lingual direction in order to obtain a taper to these walls, which is going to be somewhere in the range of 10 to 16 degrees taper for the provide for the draw of the preparation. The trial compound impression is taken using the low fusing compound stick and placing a marking on the compound stick of approximately 1 inch in length. Then it's going to be heated in the flame at its tip, fingers moistened in water, and the compound is formed into a cone shape. Now this is necessary in order that the compound can be inserted into the prepared cavity and be extended into the rather constricted portions of the cavity with good access. Now, when this has been formed down to a fine cone shape, then it will be possible to insert that into the cavity, and the stick is then broken off where the length marking was placed, so that there is a small portion that can be placed into the mouth, or in this case, into the visidont with good access. Now, if too much softening of the compound took place and too great a length, it can merely be placed into the water and solidified so that it is stiffened up and will not be compressed excessively when it's placed into the cavity. Now for the placement into the cavity, the compound will be again warmed at its very tip and then carried into the prepared cavity. The compound is placed into the cavity and considerable pressure placed upon it in order to gain a registration of the cavity form to this point. The compound is carefully removed, and the object here is to evaluate this occlusal portion of the cavity to be sure that there is taper in these walls which permitted the compound to be removed from the cavity. This tells us immediately that there is taper form being developed and that the depth of the pulpal floor is satisfactory and is getting smooth. Returning again to the mesial occlusal and carefully progressing toward the mesial aspect, and then beginning to penetrate cervically just along the dentino-enamel junction, leaving a thin layer of enamel, if possible, near the adjacent tooth. Now, some of the enamel is beginning to come out of this one, and the purpose here now is to initiate this proximal box and begin to establish the cervical depth. Now, once that has been established with this round burr, then it's time to return again with the tapered Fisher burr in order to do three things in this proximal box. One is to establish cervical depth. Second is to establish the taper. And thirdly is to establish the extension to the buccal and lingual that is necessary. Now, using the burr as a guide, it's possible to place it to the buccal aspect and determine about the location of the cervical floor for this preparation. It will be just past the proximal contact area and just extending beyond the carious lesion in that proximal portion. Gauging visually the extent to which the burr is extended cervically, it's possible to use the burr length as a guide when it's placed into the cavity. Now, the burr is placed and cervical depth is established, and then the finger positioning of the handpiece is stable so that the burr cannot extend any further cervically, and the burr is going to be tipped a little bit more toward the buccal and then back toward the lingual in order to establish the taper for draw of the proximal box area. Again, to the buccal, and then to the lingual to establish the taper. And all Also, since this preparation is very small, the establishment of the taper, in this case, very nearly establishes the extension to the buccal and lingual. A slightly greater amount of taper, or rather extension, is necessary to the buccal aspect. Now then, it's necessary to step back to the occlusal and blend the occlusal outline form with the proximal walls at the junction of the two. This should be smooth flowing outline form with graceful curves and no sharp angles remaining. All right, it's possible to look in the proximal box area and note that the cervical depth that's been established just breaks contact with the adjacent tooth, and it's possible to pass and explore through that area at the cervical. It's also possible to note that there is taper in the lingual wall, there's taper in the buccal wall, that the axial depth has been established so that the axial wall is indented, and that the extension to the lingual and to the buccal are adequate, although, in this case, the enamel shell to the proximal has been already removed in the process of development so far, but the buccal aspect of the cavity of the enamel is still in contact with the adjacent tooth, and it will be necessary to remove this portion. Now, using this small enamel hatchet, it's possible to plane the buccal proximal wall in the area where the enamel is still in contact with the distal surface of the first bicuspid. It's necessary to clear this contact with the adjacent tooth prior to the disking procedure, which will be carried out soon. It's important that this also follow a form of taper in this proximal wall. And the flare here is only carried as far as is necessary to clear that contact area. And it can be seen now that the area cleared. It's a little bit limited, and we'll need a slight additional amount of planing in order to have adequate clearance established. Going back to the occlusal for a moment, smoothing the occlusal walls, keeping the burr positioned so that adequate taper is provided, and carrying over into the area of the lingual groove. On the second bicuspid tooth, a lingual groove extends at this point, and so it's necessary to lean over that burr, lean it toward that groove, which provides a greater amount of taper at that area, but provides for eventual finishing of the gold into that groove very smoothly. Making certain now, as the distal occlusal wall is refined, that it does have taper. It must have taper in order to allow for support of the enamel with underlying dentin in that area. Coming around toward the . buccal occlusal wall, again being assured of the establishment of taper and smoothing of the wall. And finally, the refinement of the proximal box area, and using this 169L, which is a very slender taper fissure burr, to accentuate slightly the proximal axial line angle. This provides for improved retention form and provides the desired curvature to the axial wall. Smoothing of the cervical floor, the proximal walls, and the axial wall. When the internal aspects of the cavity have been completed, the rubber dam is removed and the lightning disc is used with the abrasive side placed toward the mesial aspect of this tooth where the disking is to be performed. The disc is pre-tested without rotation of the instrument before proceeding. It's pre-tested to determine that there is access without any binding for the disc at the buccal proximal wall and at the lingual proximal wall. When that access is assured, the disc is again placed at the buccal proximal wall, and it must be positioned so that there will be taper toward the occlusal aspect, and that the disc is positioned in this orientation so that it is approximately parallel to the axial wall. The disc then is brought into rotation, and a small amount of enamel is removed. And this provides for extension of the proximal external outline form to the buccal aspect, and then the disc is carried and positioned similarly at the lingual aspect, and vision is possible by looking through the buccal and the occlusal to position the disc and to be sure of its access. Results of the disking are seen here in this occlusal view, which shows the buccal proximal and lingual proximal slices. And in this case, they have coincidentally come out to be extremely aligned and parallel, but were placed individually buccally and to the lingual aspect. This may be done at high speed or low speed, but with the low speed, in this case, a little better control is obtained, and the instrument is placed with the tip set on the cervical floor and then just moved mesially until it slips off the cervical floor to gauge the location. Now this must be oriented also as it's carried from approximately the center of the cervical floor toward the buccal, and is kept in contact with tooth tissue all the way along until it's carried right out of the cavity. Then the rotation is reversed and carried back to the cervical floor, moved off the cervical floor, and started again at approximately the center of the cervical and moved toward the lingual. And this time, the burr is going to be tipped somewhat to the lingual in order to assure that no undercuts would be established in the placement of that cervical bevel. Now the rotation here is important so that the burr will not roll out of the cavity over the cable surface finish line. Then coming out of the cavity toward the occlusal, the junction of the proximal slice and the occlusal wall are an area of sharpness and should be smoothed by taking this finishing burr and merely rounding this, and this is referred to as the beveling or rounding of the entrant angle, the angle of entrance to the occlusal of the cavity at the junction of the proximal wall and proximal slice. This is done at the lingual. It's also done at the buccal. Now, anytime it's necessary to steady this contra-angle for greater control in this area, it can be done by using both hands on this contra-angle head in order to steadily and smoothly carry that beveling to refine that entrant angle. Another area that must be done at this time is to touch the pulpal axial line angle to give that a slight roundness or bevel. Upon completion of the refinements of the cavity preparation, the cavity will be lubricated with microfilm in preparation for the taking of the trial compound impression. The trial compound impression of the proximal occlusal cavity preparation differs slightly from the occlusal in that this metal matrix has been prepared in a kidney or ovoid form, and then it's also curved slightly so that it fits around the proximal contour of the tooth somewhat. The matrix is placed into the mesial interproximal area and the gingival crevice of the prepared tooth to prevent entrapment of compound in the embrasure. The compound now has been warmed and is inserted directly into the proximal box area and compressed with considerable force so that it will reach the cervical floor and reach the cervical bevel area. It's critical that it register the bevel that has been placed on the preparation, and is less critical that it be an entire registration of the occlusal form. And so that will be held till it solidifies and cooled with some air for removal. All right, now the trial compound impression is carefully removed from the cavity. And this should be done without fracturing any portions of it. And the impression then is inspected. And several things are being evaluated. One is the direction of the pulpal floor and the axial wall to be sure that there is taper, and draw there. There is taper in the occlusal walls. The alignment of the occlusal and the proximal are evident. If there were a misalignment of the proximal box and the occlusal outline internally, then there would not be adequate draw in the cavity. And then perhaps most importantly, the registration of the cervical bevel, showing very clearly, because the compound has extended past the cervical bevel, and this shows that the bevel is blended with the slices on the buccal and lingual. It extends past the cervical floor, and especially important where it comes to the angles of the proximal box. The proximal cervical line angles are protected by having the bevel extend well beyond them, and this is a bevel of approximately 0.8 millimeter in dimension. After finally cleansing the cavity, a final assessment of the cavity form is is carried out. The occlusal outline extends through the occlusal portion of the tooth. The fissures and pits have been removed. The occlusal dovetail is present. A smooth, flowing, graceful curvature of the occlusal walls is present. And the pulpal floor depth is just into dentin. There's taper in these occlusal walls for draw, and the occlusal aspect toward the mesial opens into the proximal box, which has adequate depth of axial wall established in dentin, clearance of and flare of the proximal walls, and then the extension of the slices so that the outline form provides for extension for finishing of the restoration and cleansing to this area of the buccal proximal form of the tooth, and to this area in the lingual proximal form of the tooth. These are aesthetically acceptable and will be functionally acceptable. The cervical depth is adequate and breaks contact with the adjacent tooth, and the cervical bevel blends and combines the cavity form at the slices and the proximal box at the cervical. And then the internal angles have been rounded or beveled, and the cavity outline form is completely smooth flowing. The internal outline form is properly in dentin, and the finish of the cavity walls have been established smoothly and very well defined, and the taper is present throughout the cavity so that the walls diverge toward the occlusal and permit draw for withdrawal of the wax pattern and insertion of the casting at a later time. This completes the preparation of the cavity for a Class II indirect gold inlay.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.